Welcome back to American Medicine Today, presented by the Bonati Spine Institute.
At the Bonati Spine Institute, all of the procedures are performed here at our 11-acre facility. From your initial consultation and exam to x-rays and MRIs in our on-site imaging center. All surgeries are performed in one of our 3 surgical operating rooms, and recovery is just steps away. This allows a surgeon more access to their patients and allows you to go home the same day. Dr. Bonati was born in Italy, grew up in Chile, and is proud to call himself an American citizen. He enjoys the opportunity and freedom our country offers to everyone that is willing to work for a better life and exercise the rights we enjoy. The men and women of the armed forces that have sacrificed for our freedom sometimes cannot receive the medical treatment necessary to get them back to life. Dr. Bonati and the staff of the Bonati Spine Institute is proud to assist some of our wounded warriors by providing surgical procedures at no charge. Here's just one of our Help for Wounded Warriors Back to Life stories.
I originally injured my back in Vietnam. What caused it, I don't know, but I was down for a couple of days with severe low back pain. It sort of went away, and then I injured it again in a training program in Panama, and that time I was hospitalized for a couple of weeks in traction and muscle relaxers. In the last 17 years, just progressively worse, to where the last couple of years my lifestyle was pretty much housebound.
I think we see that a lot as far as many patients have been to several doctors, several different methods in trying to deal with their problem, and oftentimes on a large amount of medication, and to take those patients and help them by relieving the pain and thereafter being able to detoxify off narcotics and then go back to being productive. I think that's very rewarding.
Through the years, just developed severe low back pain. I had back surgery there at the Tampa VA hospital, and if anything, it made it worse instead of better. I ended up retiring because of my low back pain.
We get the results. We get the results. And we actually take patients that have gone to those places, and we see the surgeries that are not near the equivalent of what we do here.
You kind of feel guilty when your wife is out in the backyard working, doing yard work, etc., and you go out to help, and she looks at you and say, "No, honey, I'll do it." So, yeah, quality of life, being able to do what you used to be able to do and not be ashamed of looking out the window and watch your wife do everything that you used to do as a couple.
Well, I'm always thrilled to be able to help our patients, but for those who have made tremendous sacrifice and have seen very difficult times, it's an honor to be able to ease their pain and to give them comfort. So it's always exciting to have special folks come in through us.
Go to the football and basketball games, limp as I climbed up in the bleachers, would sit for a while, stand for a while, sit for a while. That was the quality of life that I had before the surgery. Last year, I think I had more bad days than I had good days. On a bad day, I'd spend most of the day in my recliner chair or in bed. And on a good day, I would get out and about with a pronounced limp and quite a bit of pain. And then I was at a football game with my grandsons, and one of the founders of the Laser Spine Institute, son played football with my grandson, and he noticed me limping quite a bit and asked me my problems. I shared with him what I'd gone through, failed back surgery, and he said, "You know, I really need to get a consult with the Laser Spine Institute," which I made an appointment. Then I received a call from a friend of mine and said, "You know, probably you would want to talk to Dr. Bonati." And so I did, had a MRI, and after about a 45-minute consult, I said, "You know, this is something that I have to go through with." Quite reluctant to have back surgery again after having failed back surgery. I have trust and faith that he can relieve some of my pain.
Well, it's amazing to see somebody who is sick and is without hope and has situations where they were already told that nothing can be done and we can correct that.
I went through 3 surgeries with Dr. Bonati. At the end of the 3rd surgery, I went home. 10 days later, I went back. Still had a little bit of a limp, a little bit of pain, and Dr. Bonati injected both of my sacroiliac joints. And that gave me instant relief. And then over the next couple of weeks, each day just seemed to get better and better and better, and to where now I'm virtually pain-free. When I went in to talk with Dr. Bonati, he said, I have a desire to donate 1 surgery a month to veterans and our active duty. And if you are willing to go through with the surgery, then it will be pro bono under my Wounded Warrior project that I have going.
It's wonderful to be able to help the Wounded Warrior veterans. My father was a World War II veteran, and he was a land surveyor and professional engineer. And growing up, I worked for him a lot of summers, and he always gave discounts to vets and to clergy, and I thought that was a pretty good practice. This is a group that has proven themselves. They're most worthy of extra effort on our part.
Dr. Bonati told me, stop limping. My wife thought he said stop wimping. And so we got home, she said, okay, you can't wimp anymore. I said, honey, he didn't say wimp, he said limp. And so I did stop limping. 2 weeks after the last surgery, I really put my back to a test. I went fishing in Canada for halibut, king salmon, 4 days and 4 nights on a boat. And I taxed my back to the max, and I was totally pain-free for the entire trip. Well, being completely retired now, I have 1 son and 2 grandsons that live right down the street. And the opportunity to spend as much time as I do with my son and 2 grandsons means an awful lot to me. Definitely use the Eagle 5, my boat, out in the backyard a lot more, and make all their ball games or football games, basketball games. Pretty much anything that they want to do, Papa can still hang in there now. Well, I'm building a house right next door, and it has 4 flights of stairs. And so I test my back quite often by walking very briskly up and down the 4 sets of stairs in the house next door. So if I can do that, I can probably get up and down those bleachers without wimping again. Well, I appreciate you getting me to a state where I'm virtually pain-free, and I also appreciate what you do for our veterans and our retired military.
Well, my part is very small, but it's always exciting to see the response of our patients, to be a part of that experience. It's you know, I'm just there to help and make the process easier for them, but Dr. Bonati makes the magic.
When I first met him, and he reviewed the you know, the MRI, and was, while reviewing the MRI, was saying, you have a problem here that gives you pain. It should have pain here. And it's like, well, exactly. And it's like, this is unbelievable. And then when he shared with me the procedure, the minimum invasive procedure, the rapid recovery, I was just convinced immediately. And then to find out that Dr. Bonati is such a great guy that he wants to donate 1 surgery a month to our veterans and to our wounded warriors is just unbelievable. What a heart.
Every time that I walk in the operating room, when I am scrubbing my hands, I always thank God for the opportunity to do this. And it's very unique, that feeling, and you need to appreciate it. The same like the patient. When you are doing the surgery, the patient appreciates that, And it's amazing how easy the word God comes in their minds.
We're not going anywhere because we believe in what we do. There's no other place that will give you those immediate results, first of all. But secondly, you're talking about patients' lives. There's nothing else that may make you feel like you're making a difference. No other place will do it.
Well, I've had a lot of people ask me about my back, and when I explained to them that I'm virtually pain-free, I have recommended, since my surgery, 3 people to Dr. Bonati. And my comment to them was, it worked for me. You need at least a consult. Get an MRI, get a consult, and then you make your decision from there. So anyone that had pain like me, I definitely recommend the Bonati Spine Institute.
When we return, we'll be joined by world-renowned surgeon and inventor of the Bonati spine procedures, Dr. Alfred Bonati, to discuss the growing concern of our veterans and the care they need, but in many areas of the country are having a hard time receiving. In the Tampa Bay area, we are lucky to have some of the finest veterans hospitals, but the government system and the management of the VA is flawed. Here are some of Dr. Bonati's thoughts on the VA and why the government and the people need to do more to help those that deserve it most.